This video is the first in a series of 5 videos rating the effectiveness, invasiveness, costs, and side effects of the treatment options for erectile dysfunction. In my research since my first video on erectile dysfunction, I realized that there are at least 10 different categories of treatment options for erectile dysfunction. And I thought that to put all the information about all 10 of them in one video would make too long a video, hence this series. Each video in the series will rate 2 of the treatment options on this 5-point scale. I think that the item on the scale that may require explanation the most is invasiveness. I will not use the contemporary definitions of invasive versus minimally invasive medical procedures because there are many definitions that do not agree on the size of the incisions that qualify as minimally invasive. So for the purpose of this series of videos, any treatment that involves cutting the body open by a surgeon, however small the incision, I will rate such treatments as highly invasive. A treatment will be rated as minimally invasive if it does not require an incision or cutting the body, but the treatment is done by a medical specialist on the exposed part of the body. Injections with needles and treatments that insert objects deep into the body through natural body orifices such as the anus and the mouth will also be considered as minimally invasive, while a non-invasive treatment is one that does not require the presence of a medical specialist and no incisions are required. The man does the treatment on himself or their sexual partner does it. I covered exercise as a treatment option in the first video, so I will not repeat it here. If you have not seen my first video on erectile dysfunction, click on the link that shows up here. And welcome. You're watching Basic Hale. Let us begin this series by rating ShockWave therapy and testosterone replacement therapy on the 5-point scale. ShockWave therapy, or low-intensity extracorporeal shockwave therapy, to use the full name, is a relatively new treatment for erectile dysfunction. The first clinical trial of this treatment was published in 2009. Shockwave therapy uses high-frequency sound waves to create micro-damage in the penis. Naturally, the body responds to damage by promoting healing. The body promotes healing by increasing blood flow to the area of damage. It also increases other healing factors like vascular endothelial growth factor. This will cause the formation of new blood vessels in the damaged area by a process called angiogenesis. Since the main problem in erectile dysfunction is reduced blood flow to the penis, ShockWave basically reverses the problem, so you would expect it to be very effective at improving erectile dysfunction. The most recent systematic review on ShockWave therapy reveals that it improves erection hardness scale score for men with erectile dysfunction significantly. That this man improved from a score of less than 2 to a score of more than 3. On paper, this is a big improvement, but in statistics, you may not see the whole truth if you do not ask the pertinent question. So, the pertinent question: is the improvement reported here enough to achieve the objective of sex? Well, the answer to that question is mostly no, because the researchers also used the Sexual Encounter Profile, or SEP questionnaire, to ask the men that participated in the research about how effective they found the treatment. Question number 2 and question number 3 are the most important questions in the SEP questionnaire. You can see the 2 questions on the screen now. Based on the responses of the men, there is no significant difference between men who were treated with shockwave therapy and the men that received placebo or sham shockwave. This means that there is no proof that this treatment is effective at improving sexual encounters for men with erectile dysfunction. But if we consider the results based on the erection hardness scale alone, the latest systematic review is consistent with other studies. They show that shockwave therapy is effective in the short term, but not in the long term. Other studies also show that shockwave therapy is not effective for erectile dysfunction caused by diabetes, and it is not effective for severe erectile dysfunction, that is, erection hardness score of 0/4. So based on the latest systematic review, I would rate the effectiveness of shockwave therapy as low. One session of shockwave therapy costs an average of $450, and the therapist would typically recommend between 6 to 12 sessions of treatment. If we settle on an average of 9 sessions of treatment for each man to get the little benefit that it offers, that will mean a total cost of $4,050. After these initial treatments, some men will still require maintenance treatment every couple of months, so shockwave therapy is moderately expensive. Shockwave therapy is applied directly on the penis, like a pregnant woman getting an ultrasound scan. The only differences are the body parts on which it is applied and the type of sound wave used. Based on the definitions of invasiveness that I mentioned earlier, shockwave therapy is minimally invasive. Regarding side effects, there have been rare reports of bruising, bleeding in the skin of the penis, and infections after shockwave therapy. Other side effects reported are painful erections and difficulty having sex. Although I would consider infections, painful erections, and difficulty having sex as severe side effects, all the side effects will resolve spontaneously after a few weeks. Therefore, I will rate the general severity of side effects as moderate. All the side effects are relatively rare, so I will rate the general frequency of side effects as low. This brings the final rating for shockwave therapy to a total rating of 5/10. Next, hormone replacement for the treatment of erectile dysfunction. Testosterone is the most commonly used hormone. Other hormones that are sometimes used in specific cases are human growth hormone and the thyroid hormones, which are thyroxine and triiodothyronine. But these other hormones are rarely used, so we will focus on testosterone replacement. The use of testosterone replacement to treat erectile dysfunction started in the 1940s. A recent systematic review on the effectiveness of testosterone shows that testosterone replacement alone does not improve the erectile function of men with low testosterone. An earlier systematic review in 2020 reveals that when testosterone replacement is combined with oral phosphodiesterase, such as sildenafil, it significantly improves erectile function. Based on these findings, I have rated the effectiveness of testosterone replacement as low. Rating the invasiveness of testosterone replacement was a bit complicated because there are many ways of doing it. It can be done by injection into the buttocks or thigh muscles. This requires injections every 2 weeks. It can also be taken as oral medication every day or as patches on the skin. Other methods of testosterone replacement are gel creams rubbed on the skin of the belly every day and pellets of testosterone implanted under the skin of the buttocks. The most common methods of testosterone replacement are intramuscular injections and skin patches. Based on this, I have rated the invasiveness of testosterone replacement as minimally invasive. The cost of one testosterone injection is between $30 to $100 depending on the dosage. Typically, injections are done every couple of weeks. This will be a yearly cost of between $780 and $2,600. I consider these as moderately expensive. The cost is even higher for transdermal gel patches. A pack of 30 gel patches, which will last about 1 month, typically cost around $500. This is a yearly cost of $6,000. But the patches do not require the presence of a medical professional to use them, so some men might prefer them to injections because they are non-invasive. Based on this cost profile, I have rated the cost of testosterone replacement as moderate. There are many side effects of testosterone therapy. These include mood swings, acne, sleep apnea, enlarged prostate, and low sperm count, leading to infertility. Enlarged prostate would be considered as a severe side effect, and the rate of enlarged prostate among men receiving testosterone replacement therapy is as high as 17%. Sleep apnea and low sperm count would also be considered as severe side effect, but the frequency of their occurrence are not coherently and consistently documented in published research. For example, this systematic review from 2023 showed that sleep apnea can happen in up to 16% of men receiving testosterone therapy. However, the study went further to question the credibility of this finding because some of the studies included in the systematic review did not consistently document whether the treatment was testosterone replacement or testosterone supplement. These are different therapies. Some studies in the past have reported that testosterone replacement can cause an increase in red blood cell count, which thickens the blood. This condition, also known as polycythemia, increases the chances of having a stroke, pulmonary embolism, and deep vein thrombosis. However, a recent systematic review shows that testosterone replacement does not increase the risk of thromboembolism and these diseases. Other studies in the past have also claimed that testosterone therapy can cause heart attacks. Again, a recent systematic review showed that this is not true. Considering that some of these side effects, for example, enlarged prostate, will not resolve spontaneously, I have rated the severity of side effects as high. Also, based on the frequency of enlarged prostate mentioned earlier, I have rated the frequency of the side effects as moderate. This brings the final rating for testosterone replacement to a total rating of 3/10. To recap, in this video I have rated the cost, the effectiveness, the invasiveness, and the side effects of 2 treatment options for erectile dysfunction: ShockWave therapy and testosterone therapy. In the next video, I will do the same for injections into the penis and penile implants. Thank you for watching this episode of Basic Hale. Please subscribe to my channel to support the production of more content like this one, and I will see you in the next one.